Fantastic, thank you. So as I said, I'm very, very delighted to be asked to do this presentation today on the UN resolution, the promotion and protection of the rights of children. And I'm going to talk a little bit about the content, well, a lot about the content actually, but emphasize why the resolution is important to children without parental care or those at risk of being so. And the UN resolution, as you may know, was adopted because it was the 30th anniversary of the adoption of the Convention on the Rights of the Child. And there was proposed a new resolution to recognize the anniversary on the rights of children. And I have to say, those of us working for many, many years in child protection and alternative care were absolutely delighted and surprised when the focus of the resolution, the new resolution on the protection of rights of children, was actually a focus on children without parental care or those at risk of being so. I mean, it could have been on what we call the big guns, it could have been just on education, it could have been on health. And we often feel very neglected working, I think, in the child protection sector and particularly in alternative care. And I also want to really, really give tribute to SOS, because there's a team in SOS, particularly New York and Switzerland, who really, really, really pushed this resolution and worked a lot with different states and nations and governments to make sure this resolution did have this focus. So it was an amazing surprise. And there was a lot of work that we did as a group behind the scenes to try and influence, if you like, although we weren't supposed to do that, but let's say advise governments on what should be in the resolution and how to vote. Just to say, the resolution reaffirms, it starts by reaffirming many of the existing international treaties, including the CRC and all the optional protocols. And most importantly, it recognizes the UN guidelines for the alternative care of children, which again, we were really, really pleased about, because the UN guidelines, you know, although we've been doing a lot of work in the last sort of 10 years, 12 years since they were launched, they have got lost a little bit. So the fact that they were highlighted in an international treaty was again amazing. It reaffirms the general principles of the Convention on the Rights of the Child, including best interests of the child, non-discrimination, participation, which is very important, and survival and development. But I think one of the things you will see that runs right through the resolution time and time again, and I think I did count, and I can't remember how many times, but at least 12, 13 times throughout the resolution, the best interest of the child is mentioned many times. And also, of course, it brought in the Sustainable Development Goals, the SDGs. It looks at principal roles and responsibilities, and it reaffirms that the family has the primary responsibility for the nurturing and protecting of children. And here we go. Everything should be done in the best interest of the child for their full and harmonious development. So we see a lot of the language again that's in the CRC and in the UN guidelines for alternative care. And also that children should grow up in a family environment. And this is something that I'm very happy to see, because we've done lots of work listening to children around the world. What do they want? Happiness, love, and understanding. That's there is very, very important, because it actually qualifies, it gives some quantitative measurements to this resolution for once. Again, calls on states to give the primary responsibility to protect, promote all of human rights, including the child rights. But it also recognises all our roles in the international, regional, bilateral, multi-stakeholders, partnerships and initiatives. So we're all mentioned in there. Again, it goes back to the CRC, and it particularly talks about the role of the state in terms of when a child must temporarily or permanently deprived of his or her family environment. And at that point in time, the state has to offer special protection and assistance to these children. And they should, again, ensure that there is safe and appropriate quality alternative care. And again, we're getting a lot of qualitative indicators this time into a resolution. I think the other very, very important thing throughout the resolution is it brought in this multiple intersectoral, intersecting issue of all the vulnerabilities that children face. We need to break out of silos, because we know actually that if you're poor, you're more at risk of social exclusion, stigma. If you belong to an ethnic minority, you're more at risk of violence, poverty, social exclusion. If you're a child with a disability, you're more likely to be at risk of violence, again, stigma, discrimination. So we can see that there's an intersection of all these issues, and it's not just one, but they all interplay and they all relate. And that we need to start looking at a multi-sectoral approach. We need to look at everything, all the factors, at all levels of international, regional, at a state level, at a local level, and a family level, to see how all of these things affect children. And it also recognizes the impact of many different environments. So, of course, humanitarian aid, emergencies, armed conflict, natural disasters. And here we have climate change. And this one is particularly important because it's going to cause, we think, mass migration, for instance. It's going to be the biggest cause of mass migration in the future. And we're also looking at, you know, the way it causes poverty through famine and floods as well. So we're going to have lots of natural disasters. So it's very, very important that we start looking at climate change that we've sort of ignored in the child protection sector before. And of course, disease outbreak. And at this time, it particularly mentioned HIV and AIDS. And this resolution was literally passed not long before the onset of COVID. So of course, COVID wasn't in our minds at the time, but of course it's now very, very relevant. And we see the massive impact on child protection around the world because of COVID. So what does it tell us we have to do? What are the actions? So first and foremost, we must look at child protection. And we must have efforts to prevent and protect children from all forms of violence, because we know that children are coming into the alternative care system because they're needing protection. And again, it recognizes what we call victimization. So we know that you don't just suffer from one form of violence, or abuse, neglect, that these also interrelate. So that very often if you have, if there's physical violence, there's often emotional violence. If you're trafficked, then you're going to suffer from a lot of these other issues that you've seen here. So again, it's about looking at all the different things that happen to children and the polyvictimization. And so it particularly says we have to recognize, and I'm particularly pleased to see this because I've been saying this in many, many times over the years, alternative care is an integral component of a child protection system. It is not separate. And this has been the problem around the world in many countries. We have set up alternative care not as part of the child protection system. That has meant that children are coming into care not because they need protection, but for the reasons that are, you know, that they shouldn't be coming into care. If we have a strong child protection system, we ensure that those who are at risk and do need state protection are the ones that are recognised. Normally, I would spend a lot more time on this particular slide, but I've got a lot to go through today because the resolution is very long and it's packed with information. But it's very, very important that we have relevant laws, policies, statutory guidance. And I particularly call attention to statutory guidance, because what we find across the world is we have a lot of good legislation now. Over the last 12 years, I've been doing a review of legislation in many countries, and we are improving legislation, but we're not implementing it because the laws sit there and frontline workers don't understand what the law means to them. So statutory guidance is essential. We need somebody, a body, a ministry to coordinate and have oversight of a national child protection system. And we need data management. If we don't have data, don't have quantitative and qualitative data, our plans will just fall into the sand. We absolutely need to know who are the children and families we need to protect, who do we need to support, what services do they need, how many alternative care places do we need, how many social workers do we need, how many care workers. So if we don't have the data, we can't plan effectively, and we don't know what's happening to children. So it's not just about the number of children in care and where the care centres are, it's everything about their lives. We need the structure, and by that it means we need, you know, good social work services, good health services, good education services. We need those systems again at a central, regional and local level. And we need a sufficient and skilled multi-sector workforce. And I will be talking about multi-sector approach later on, but it takes all of us to work together to have good, well-qualified, well-trained workers. And we need child protection case management, and I'm going to come on to that in the next slide. We need a continuum of suitable care options, and I'm going to talk a lot about that. And we need advocacy and awareness raising, because a lot of the things that happen to children, a lot of reason children come into care is about stigma, discrimination, social exclusion, and a lack of understanding of child protection. And Bekele is going to talk a lot more about advocacy, but we need to build on positive attitudes and practices, but we need to challenge those that are really, you know, not protecting children. So I have looked at the UNGA resolution very carefully, and I believe there are two basic principles that we see reflected in the UN guidelines for alternative care, and one of them is the necessity principle. So the necessity principle, there are two principles, necessity and suitability. And I'll talk about the suitability in a moment. But the necessity principle means that no child should be removed from parental or family care if it is absolutely not necessary. Therefore, it's been rigorously assessed that it's in their best interest that they are removed or separated from parents or family because of their own protection, and it's in their best interests. We are removing so many children around the world, or allowing children to come into care, being relinquished into care when it is not necessary because the child didn't need protection, we needed other forms of support. So it's very much about gatekeeping and rigorous and systematic procedures to think about the best interests of the child that should be made on a case-by-case basis by suitably qualified professionals in a multidisciplinary team. And also it says in the resolution, as it does in the UN guidelines, this should be done through a judicial or an administrative or other adequate and recognized procedures that have legal safeguards. And most often these decisions are being made by individuals. It's not going through a proper administrative process. And that every decision we make must be done with full and meaningful participation of children. And that's not just tokenism. We have to really think about what is full and meaningful participation. And that means it's age appropriate, it's ongoing, it's about children being able to make informed decisions. So we need child protection case management to make sure we uphold the necessity principle. And these are the steps that we need to think about. So we need to think about how children are being identified and registered or referred into an administrative process. And we really have to ask the state to take responsibility for that. And even as NGOs operating those systems in different countries, all the resolutions tell us is that we really should be working together under a state system. They have primary responsibility. We then need tools and processes so that there is a rigorous assessment. So we, again, as we've said, really understand, is this in the child's best interests? Could we protect the child or support the family if it's issues of neglect, for instance, that really need addressing through family support services? Or is the child at serious risk of harm? If a child comes into the care system, we have to make sure there's very good care planning and case planning. And if it's case planning, that means it's for children who can remain in their families and communities. If it's care planning, it means a child is coming into care, and we have to map that care and make sure that care is suitable for each individual child and who has responsibility for what. It also means everybody has a responsibility. It's outlined in the case or the care plan as to who's going to deliver what services, and that those plans must be regularly reviewed, monitored, and to make sure if a child comes into care, they can go home as soon as possible, or we find them a permanent solution if that's never going to be the case. And if it's a case plan and we're looking after the family or and working with the community, then when can we get to case closure? So you need tools, you need processes, you need mechanisms to make case management happen. Then the resolution very much looks at improving the alternative care system itself. And as we've talked about, there should be lots of work done to prevent parental and family separation. And everything should be done in the first instance to ensure the child remains in the care of their parents, or if appropriate, other close family members. Prevent. We have neglected prevention very much. We put a lot of effort and money and ideas into alternative care, but we have forgotten about actually the fact that most children should not be in care. We talk about orphanages, but in fact 95% of children, we reckon, have at least one, if not both, living parents of children who are currently in alternative care, and we believe that most of them are there unnecessarily. So children must not be separated either unless there's been a competent authority, as we said, to assess the situation and determine if that separation is really necessary. And ensure removal from care is only a measure of absolute last resort. We also recognise the multidimensional aspect of poverty, stigma, discrimination, as we said, and social exclusion. And we recognise that financial and material poverty should never, never be the only direct and uniquely reason for justifying children being removed from care, i.e. just because you're poor doesn't mean you need to come into care. We're looking at risk and lots of other risks. So the financial and material poverty should never be a reason for removing a child from parental care alone. It should never be a justification for taking a child into your care service, and it should never be a reason for preventing his or her reintegration back with their family. And as I said, we speak of orphanages, but again, these children are not orphans. So we need to look for signals if we believe that there is needs to support the family, and that we should look at these different aspects. The resolution particularly says we should start looking at the human rights of the whole family. We should look holistically. We should look at issues of access to quality education, to health services, to economic resources, including full and productive employment and livelihoods. We need to look at social security when it's necessary. So we really need to be linking all of these different services, including social policy, with child protection. We need to look at social cohesion and social integration. We need to look at issues of positive and caring parenting and provision of childcare. These things are specifically outlined as guidance. So this resolution is quite different from others in that it just doesn't have an article saying this is the right. Gives us a lot more detail about what we should actually be considering. And again, this very important aspect of a multi-sectoral approach and making sure we look holistically. And also, particularly, they've highlighted issues of children with disabilities, and we need to provide information services and support to children with disabilities and their families, so we prevent concealment, abandonment, neglect, discrimination, and segregation. So we know that, first and foremost, a lot of children who need our protection, who have disabilities, are actually being hidden. I can give you an example of, I worked in North Iraq, and my social work team alerted me to 2 girls who had no use of their legs, and in a daytime their father locked them in a coal shed while he went to work. So children were being concealed because of their disability. So we need to look at advocacy, awareness raising, and tackle these issues. And it also calls for special attention to migrant children, trafficked children, street associate children, and children in detention, so that we don't forget those children as well and they receive appropriate protection and assistance. So in summary, we have to ensure children are not being accepted into our alternative care programs unless there's rigorous multi-sectoral participatory assessment to determine necessity. We have to look at best interests and protection. And children should not be accepted if they're living safely with their families, but may need additional support. And we have to remember, poverty does not automatically equate to neglect. We know there are millions and millions of poor families around the world that are taking great care of their children. So then we come on to the suitability principle, and the suitability principle means that there should be a suitable continuum of quality care. That means a range of different quality care available so that each child can be matched to the type of care they need. So if there's been a rigorous assessment and they really, really do need care and the state's protection, then we can match each child to the different type of care. However, there is a real focus on optimum outcomes for children. We want positive results and sustainable life outcomes for children, including looking at their social, physical, emotional development and well-being. And that care is absolutely child-centered in a caring environment. And that means we should provide quality alternative care options within the wider family, if first possible, if not within a community setting, in a family setting. And what we mean by that is, we look at family-based alternative care such as foster care. And we've also been looking at small group homes within the community. And there's been a lot of discussion about this and what does this mean. UNICEF in what was the CCIS region, which is now the Central and Central Asian region, have just developed a white paper, and they are now saying that a small residential care setting is a house in the community, in a street, just like there are any other house in the street with no more than 6 children. So we're beginning to get some real distinct guidelines on this, and making sure that it's, bearing in mind again the children's best interests. Here we go, the resolution brings up best interests again for emergency short-term and, if necessary, long-term care, although we want care to be temporary if possible. We're also looking at where is foster care most appropriate, but we know there are few children. There are some children with special circumstances, such as those who are older and maybe about to go into independent living, those who really do not want to, and I've met children who do not want to go to another family. They say, I have a family. I'm going to go back to my family. I don't want to go into another family setting. There may be children who have such trauma that they've not been able to. I know children have been in 20 foster care placements. It has not been the right place for them. So we do want a family-based setting in the first instance, but if not, we have to think about other issues. And so we really need to think about regulation, licensing, oversight, accountability, so we make sure these settings are appropriate, they're suitable, and they're of highest quality possible. Again, we need the care plans for children so they don't get lost in care and there is a pathway through care. We need to make sure there's swift accountability for those who are violating children in alternative care in all settings, because we do know this happens, and it's not just in institutions. I'm doing some studies on foster care, and we know, unfortunately, if they're not properly planned and monitored, then we are seeing some really bad violations there. And we need to have really good child-friendly, safe, accessible reporting mechanisms. So if something is happening to a child, they are able to report it to us carefully and safely. I've just put in this, which are they are there within the resolution, but not quite so explicit, but we've been thinking about indicators of suitable care. So as we said, this is a very small ratio of carers to children. Children want strong, trusting relationships. I've done a lot of work with children, asking them what's important to them. And time again, it says, I want to be loved, I want to be cared for, I want to be trusted. I want somebody to listen to me. So that's very, very important, and we can only do that if we have a small ratio of carers to children. We have to ensure that siblings are not separated unless it is in the best interest of a child. So it could be that a sibling is actually abusing another sibling, so we have to take that in mind. But where possible, we must keep siblings together. And this is where foster care or small group residential care comes into play, because sometimes we have large families and it's very hard to find siblings who are 6, 7, 8 in size, to find them the suitable care if there is a protection risk in that family. Children must not be isolated, and they must actively engage in the community freely. They must not be behind locked doors or locked gates or walls. They must be able to be children like any other child in their community. And there must not be a strict regime that is good for the care workers. It must be a regime that suits the children. It's not regimented. It's not like being in the army barracks. And we must also prioritize children's relationships with their own family. Again, children tell us time and time again, why am I not in contact with my family? Where is my family? Who is my family? And if we want to enable reintegration, we must facilitate these relationships, unless, of course, they're harmful. We must respect children's customs and values. Unless it places them at harm, we must have their full and meaningful participation again in decisions that affect their lives, and they must have access to a whole range of specialist services that they need, especially health and psychosocial support. And we often forget about trauma-informed practice. We're not talking about post-traumatic stress disorder, we're talking about trauma that children have, the experiences they faced, the reasons they're coming into care, but very often just the process of being in care can cause them psychosocial issues, and they may need special education and also legal procedures. We mustn't forget those. So again, the resolution very much asks us to concentrate on deinstitutionalization and the progressive replacing of institutionalization with quality alternative care, including family and community-based care. And again, this really reflects what we know in the CRC, but particularly in the UN guidelines for alternative care. And then it very much asks us to look at family reunification. So it recognizes that many children living without parental care do have families, as I said. There's been an estimation of this 95% of having at least one parent alive, if not both parents, and they most definitely have relatives. And so it encourages actions to achieve family reunification, unless, again, here we go, best interest of the child, which comes all the time through the resolution. And the resolution tells us every effort should be directed to children and their swift return. So how many children we know have languished in alternative care for their entire childhood? I met a young girl in Ukraine recently with a disability. She'd been placed because of stigma and discrimination into an institution when she was a baby, and she left when she was 18 and ended up on the streets. So we really need to really focus on not just prevention, but family reunification, and against an area of the process that we've really, really neglected worldwide. And therefore the resolution is really stressing this is something we have to focus on. And that means their return has to be regularly reviewed. And we know this is difficult. We know, I've met people in an SOS village in children's village in Chile doing an incredible process of reunification with families where there's been intergenerational violence. It's taking a lot of time, a lot of effort, a lot of investment, but they're not giving up. They're going to keep going with those, trying to get children back into a safe family environment. And then another issue we've really neglected that the resolution is really, really stressing is the aging out of care. We really need to look at giving young people, when they're coming to the age where they have to legally leave their alternative care placement, is to prepare them for that transition. In gaining access to employment, education, training, housing, how to use money, how to clean, how to cook, how to get on a bus, how to do all the things that 18-year-old girl I met didn't know how to do. Not having access to accommodation, not having social integration, because we know a lot of children are stigmatized because they've been in care. So we really need to think about not just their life while they're in care, but what happens when they leave our care. We have a responsibility for that, and also to support rehabilitation with their families when they age out of care, because it's incredible the number of young people when they leave care automatically go back to their families. But there's been this disconnect. There's been this disconnect in relationships. And then I asked myself, why didn't we reintegrate them with their families much, much earlier? If that's automatically where they're going to go, particularly 16 to 18-year-olds. So this is a booklet I put up. Again, it's a project I've been working with SOS. We're now rolling out across 10 countries in Africa. We've used it in, I think, 15 or 20 countries in Europe and Central Europe, and really working on preparing pathway planning for children when they're leaving care and the support for aftercare. And this time the resolution, which the UN guidelines doesn't do, is it looks at adoption, and it says really all measures must be taken to prevent and combat illegal adoptions, because these again are happening all over the world. And we're not just talking about intra-country adoptions, we're talking a lot of illegal adoptions. I've just done a review of 5 child protection systems in the Middle East, and I can see illegal adoptions are happening in all of those 5 countries, but we know they're happening in many others. And we need to support development of adoption services. And this is also relevant for foster care. We need to look at recruitment, we need to look at the legal process, we need to look at training of adoptive and foster care parents. The matching is so important. I know so many people have turned up at an institution, picked a child, taken them home, not liked them and brought them back. I think that speaks words for itself. And we need to monitor, so children cannot disappear into foster care. I think it's over 6,500 children are now in foster care in Ukraine, and we don't know where they are because 14,000 social workers got sacked overnight and nobody's monitoring those placements. Those children are at such risk. So we have to look at the adoption and foster care. For this, we really need a good, strong, capable workforce. We have to invest in training. We're only as good as the work we do. And that means we have to also, it's not just social workers responsible. We need specialized judges who know what they're doing when they make legal decisions. We need good police and law enforcement officials who don't traumatize children when they go into a violent situation. We need good lawyers to represent these children. We need good health workers and care professionals and health workers and teachers to understand and recognize when children are at risk, and to make sure we come together and make really good, suitable, careful decisions about what is in the best interest of the child, when we're both assessing the situation of the child, when we realize there may be a protection risk, and when we have that multi-sectoral ongoing support. And this is my last slide before I move on to asking you to answer some more questions. But for me, fundamentally, participation comes so high on the list of what we have to consider. We are making decisions on behalf of children, and yet when you ask children what they want, they absolutely know. They can guide us. We must listen to them. We are making decisions about their lives. And I always want us to consider what happens if somebody would walk into the room now and said, you're going to do this, you're going to do that, I'm making this decision for you, how we would feel. And how we even felt when we were children, when somebody told us all the time, this is what's going to happen to you, when we knew something else was what we wanted. We know there are situations, and I get this question asked to me a lot, well, what happens if a child says this is what they want and it's not feasible for their best interests? That does happen. If we're gathering all the information and we know about the situation of the child, we know sometimes that it's not in their best interest to stay in a family, unfortunately. Therefore, it's incumbent on us to make sure they're fully informed, we explain the decisions, we have listened carefully, and they still participate in what happens next. So for me, that's really fundamental. And then who is responsible? Well, if you look through the resolution, we're all responsible. Families, states, communities, UN bodies, donors. We always forget donors. We have to make sure that donor policies are really the right policies. We have to be influencing donors about what they do and what they fund. We know, for instance, that donors, individual donors in particular, faith-based organizations, are perpetuating the existence of very bad children's institutions because they believe in bricks and mortar. They believe in happy, smiley children. They don't trust us to be working in communities and families. Therefore, their giving is actually allowing these children to, even to be trafficked out of families and placed in institutions. And we know that, for instance, in Nepal, I think we have people joining us from Nepal, there is actually reports on children being trafficked from their families in the rural northern areas into Kathmandu, into institutions, because donors are giving and volunteers are coming. We all have, as national, international NGOs and community-based organizations, a responsibility to be part of implementing the UNGA resolution, as do faith-based organizations, private enterprises, because a lot of institutions are run as private businesses, as well as private givers. And you heard Lena saying that later on you'll be talking about volunteers and the role that they play in alternative care. So thank you very much. That's a very whirlwind tour around the UNGA resolution. It's packed with information, so I do hope that you read it very carefully. It's a lot to talk about in a very short period of time, so I've just really tried to pull out the main areas. But again, I cannot tell you how thrilled I was that finally we have a resolution that we're talking about the protection and alternative care of millions of children around the world who need the support in remaining in their families and being cared for in their families, but also making sure if they are removed for protection reasons, they're really well cared for and they have opportunities in life. And I'm also pleased that the network is looking at the UNGA resolution, because unfortunately at the time it was fully endorsed by all states. We then went into COVID, and I feel that there was a lot of work planned to roll out the resolution across the world, and we've just got sidetracked. So the fact that the network have chosen to bring this to the fore again, for me, is music to my ears, and I'm absolutely thrilled. So thank you to the network for that.
Thank you. Thanks, everyone. My presentation will be focusing on how we engage the African Union to advocate for children without parental care using the UN resolution, which Dr. Chrissie just wonderfully presented as a basis for us. Let me briefly walk you through the outline. First, we will look at a few highlights of the African context and some of the challenges and gaps facing children without parental care, and gaps in implementation of international and continental policy instruments. Then we look at some of the programmatic and advocacy responses to the challenges. Using these sections as a base, then we look at our advocacy engagement with the African Union through the African Committee of Experts. Of course, we will also look at some of the available policy frameworks which will inform and support our advocacy efforts. Advocacy work draws experiences and evidence from the ground to inform policy and decision makers. So let's look at some of the figures that helps to show the reality for children on the ground. For instance, the percentage of children to the overall population in Africa is increasing. Estimates indicate that there are about 50 million children who have lost parental care. The highest estimate we found for children in institutions, for instance, stands at 4.5 million. So both these numbers, like 50 million children who have lost parental care, and again, a number of children in institutions, they have to be confirmed. We went through various literatures and there are some variations there. The population of Africa is estimated to be about 1.36 billion, of which children account for almost half. So it raises the question, is this an opportunity for children in Africa? Is this an opportunity or a challenge, for children in Africa or even for governments? The answer will depend on what our African governments will do. And if they succeed at what they do, then it becomes an opportunity. If they don't, I don't know. So this fast population growth impacts government's ability to achieve the SDGs, particularly in the provision of basic social services. Say, for instance, the right to access basic health services. These figures show that many African countries are behind. Actually, yes, there are some African countries showing promising progress, but a lot remains to be done, by many others. For example, due to the COVID-19 pandemic, families are forcing their girl children into marriages at an early age as a coping mechanism for the economic challenges they are facing. Most countries have ratified and adopted the UN Child Rights Convention and the African Charter, which discourages this. But it shows that there is a need for a strong advocacy to stop the practice once and for all. When we look at the right to access to basic education for children, reports show that about 30 million primary school age children are out of school in Africa. And I think about 28% of young persons in Africa enrolled in secondary school are living living over 90 million teenagers, I think, and young people struggling for employment. Even those employed will be engaged in low-paying informal sector jobs. The recurrent humanitarian situations are undermining the hard-fought development gains of recent years and resulting in major social and economic setbacks. Millions are now becoming food insecure due to the recurring humanitarian situations. Families, for instance, that were showing improvements are now relapsing back into poverty. Families and their children are, forced to be internally displaced and, or become refugees, which is particularly harder for children without parental care. So specifically, what are the challenges for children without parental care and alternative care? Here is a mention of some of them. Multifaceted problems, including some of the factors we saw in the last two slides, and other major social, political, economic changes in sub-Saharan Africa, have changed the character and capacity of families and communities to care for children. More and more family breakdowns are occurring because families are weakened by endemic poverty. One of the most important factors about children without parental care is that vast majority are placed in kinship care, which is a much higher number than children in institutions. So the biggest challenge for governments and practitioners becomes ensuring the quality of kinship care. Challenges in effective economic development policies by governments and lack of employment opportunities for young persons living care is also a growing challenge. We see that aftercare provision usually has some gaps, and it's provided with the means of limited funding, further exacerbating the situation. The other challenge that is figures from a different country indicates that significant percentage of care providers and social workforce lack adequate training. When we consider reintegration, figures indicate that around 80 to 90% of children in institutional care have either one or two of their parents in the community. Considering most policy provisions, and including the UN resolution which we just saw, they give priority to family setting. And we can assert here that most of these children should be reintegrated into the families and the community. Another challenge is that some governments have no registration or monitoring mechanisms on institutions, particularly on admission, child care planning and reintegration processes, which makes it very difficult to ensure quality of care for children in institutions. Another challenge is that countries express reservations against the treaties. For instance, one country expressed reservation on the definition of the child and the age of consent at 18 years of age. In their local legal framework, the age is 16. But practically, this creates quite a challenge when it comes to, say, for instance, child marriages and other cases that are observed on the ground. Coming into care reforms, we all observe that it's gaining momentum in some of the African countries, but there are also some challenges that need to be addressed. One of these challenges is the inability of most governments to implement and enforce their policies on the ground. This is either due to lack of capacity or inadequate resources. The other main challenge is that the current care reform seem to focus more on children in institutions, rather than those in kinship care, which has the highest number. If we really are concerned about quality, then our strategic focus should primarily be on how we can improve the situation of children in kinship care, while also working on the children that are in other forms of care. Another challenge is that inability of some of the governments to monitor and regulate institutional care facilities. Governments are failing. Governments are failing to ensure improvement in the conditions for the children there. In particular, challenges include, for instance, gaps in accreditation and licensing of these residential facilities. One of the mechanisms to ensure the necessity and suitability principle is effective and robust gatekeeping, which is also mentioned earlier. However, the implementation of gatekeeping in many of the countries is still a challenge, which makes it difficult for successful care reforms. In the areas of policy, one of the main challenges is that some governments have not properly domesticated the policy instruments. The international and continental instruments need to be properly translated into local policies, then into local laws and regulations that are effectively enforced, of course. Another challenge is lack of commitment from governments to allocate more resources for children. It will take quite a lot of advocacy, lobbying, and pressuring to ensure that they allocate adequate budgets, human resources, and structural elements, towards child care and protection. Another notable point here is that one of the continental instruments that help to drive political will among African governments, in addition to the resolution in the UNCRC, is the African Charter on the Rights and Welfare of the Child. Unfortunately, this charter does not address the issue of children without parental care adequately. So this becomes a priority for a coordinated advocacy effort at a continental level, directly engaging the African Union. There are many more challenges, but in the interest of time, let's look at some of the response efforts exerted to address these challenges. When we look at the overall responses, we can observe that governments, international community, including donors and civil society organizations, are engaged in multi-sector development interventions, which are having positive impact. Say, for example, public sector capacity building, poverty eradication, health and education interventions are positively contributing to the well-being of children and prevention of family separations. There are also numerous organizations doing child rights advocacy work, providing alternative care options, child protection services, and various kinds of social and development support, which are also having positive impact on children. Regarding alternative care options currently provided and recognized in some countries, here are a few examples. You can see that, for instance, here, most countries, though they haven't made it formal, they are aware that kinship care is widely practiced. We can also see that some countries recognize institutional and residential care, though it might be changing soon with the care reform efforts currently underway in most of the countries. Some countries like Rwanda, Ghana, Uganda, Kenya, Liberia, Tanzania have initiated childcare systems reforms in collaboration with donors and organizations like UNICEF and other NGOs. The reforms, as mentioned earlier, are gaining momentum and are also making some achievements. Regarding policies, for instance, more and more governments are now developing policies and regulations focused on child rights. These include, to mention but few, in Zimbabwe, a national alternative care policy is being developed. In Somaliland, guidelines on alternative care centers. In Botswana, a sex offenders registration bill. In Uganda, national gatekeeping guidelines and national child policy. And in Kenya, national parenting and national parenting manual, national care living manual, and so on and so forth. There are many others. There are also some notable efforts involving the media to support advocacy efforts and organize policy dialogues to raise the public's and government's awareness. Examples include, for instance, in Malawi, awareness-raising campaigns were conducted among the communities on parental responsibility. In Uganda, a national advocacy campaign on alternative care was conducted using media, focusing on topics like domestic adoption, kinship, foster care, and so on. So having this as a background, let's look at our advocacy efforts and how we are working with the AU. Let me share a brief background about AU, which is relevant for our advocacy work. The Organization of the African Unity, the predecessor to the AU, at its 26th ordinary session of the Assembly of Heads of States, adopted the African Charter on the Rights and Welfare of the Child in July 1990. Please note that that Africa is the only continent with a region-specific child rights instrument like this. So this charter is an important tool for advancing children's rights in Africa. The charter builds on the same basic principles as the UN Child Rights Convention, but the charter highlights issues of special importance from cultural perspective in the African context. The charter established and mandated the African Committee of Experts on the Rights and Welfare of the Child. The committee has 11 members, including a special rapporteur on parental and child responsibilities. One fact actually worth noting here is what makes the African Committee a little bit different from the UN Child Rights Committee is that the African Committee conducts investigations in signatory countries, and the UN Committee has a little bit different approach on this. On this slide, we can see some of the policy frameworks that are available, like, for instance, the Agenda 2063, considered as a blueprint for transforming Africa. Well, it's actually a strategic framework that aims to deliver on the goal of inclusive and sustainable development. Then Agenda 2040 builds on the vision of Agenda 2063, particularly focusing on children. Agenda 2040 helps to assess the achievements and challenges faced towards the effective implementation of the African Children's Charter. And documents like concluding observations from the committee, which are generated based on specific countries, provide progress updates in the implementation of the Charter, identify gaps, and also recommend corrective actions in the respective countries. So these frameworks will serve as an input and guide the advocacy engagement with AU. One of the mandates of the African Committee is to interpret the provisions of the Charter and provide clarifications and an in-depth analysis of procedural issues. This is generally done through the general comment. As we can see in this general comments list of general comments adopted so far by the committee, some critical child rights issues have been covered, but of course we need a general comment on the issue of children without parental care in Africa to be included in this list. Our advocacy work with AU started by building partnership with other organizations like the UNICEF Office to the AU and DCA, African Child Policy Forum, and others. Our initial discussions and consultations with these partners led to the participation at the 34th session of the African Committee in Cairo, Egypt. Before the actual meeting with the committee, members, SOS Children Villages, both regional offices, collaborated to make the presentation to the CSO forum at the session, highlighting the UN resolution and the situation of children without parental care in Africa. Then SOS Children Villages presented the same to the committee and advocated for the need for a continental level response and direction. The advocacy was actually very successful in that the committee agreed to conduct a continental study on children without parental care, to have an in-depth understanding of the issues, to conduct a continental validation workshop, to organize a day of general discussion on the agenda, and draft a general comment on children without parental care. This was actually a huge milestone for our target groups and, of course, the organization as a whole. Then, after we got the green light from the committee, SOS Children Villages, in collaboration with the secretariat of the committee at AU and UNICEF and the ACPF, which is the African Child Policy Forum, we organized a regional meeting involving practitioners from different African countries, including the SOS member associations. As the committee now owns the process, Honorable Justice Maria Kwambe, who is actually the special rapporteur on parental and child responsibilities, led the engagement at this meeting. The meeting conducted consultations on the issue of children without parental care, shared experiences and lessons, and reviewed a draft TOR for the continental study. Just to quickly familiarize you with the study, the purpose is to generate information on the current situation of children without parental care in Africa, as I mentioned. This study will help to establish some baseline figures, explore the various child care options and practices, look at the government structures and policy, regulatory framework, institutional arrangement in terms of government, faith-based institutions and other traditional systems, and also explore gaps and strengths from the country up to continental levels. Of course, the study findings will be used by the committee in execution of this mandate on the subject matter also. So based on the directions from the meeting, we continued with practical steps. The partners, including the Secretariat at AU, collectively evaluated and identified consultant for the job, very experienced consultant. At the 36th committee session last year in December, the consultant, together with SOS Children Villages, presented the inception report to the committee. The committee provided feedbacks and positively commented on the progress. After that, 10 case study countries were selected and approved together with the committee. The consultant is currently finalizing travel plans to these countries to gather primary data. Actually, simultaneously with the process of the consultants, the consultants have already started preliminary works, including gathering secondary data from different reports and also conducting a literature review for the study. At the same time, the technical working group continued to conduct ideation workshops and consultations to build common understanding around the issue, and also to make recommendations on the way forward once the study findings are in place. So coming to my last slide, we find that generally these will be the areas where the programmatic and advocacy responses to the situation of children without parental care will be focusing. We hope that the continental study findings will provide clear directions in these areas. Gatekeeping, family strengthening, the range of quality and alternative care options available in Africa, which ones are working, which ones have challenges, reunification, reintegration, after care and living care, what are the best way to address some of the challenges in living care, information, how do we build information systems, monitoring and reporting capacity and actual systems, and so on. So with this, I come to the end of my presentation. Thank you for your attention and giving us your time. Back to you, Dr. Chrissie.